COVID-19 has been making people very sick since 2019. Over 1 million Americans have died from COVID-19 already. COVID-19 is a very serious disease. Right now, there is a new Omicron variant making a lot of people very sick. That variant is called XBB.1.5. In this video, I'm going to talk about staying safe from COVID-19. I'm going to explain how to know when COVID-19 is spreading a lot in your community, or if it's spreading a little in your community. I will also explain what makes a place safer or not as safe for staying safe from COVID. What are you at risk for? So, what can COVID do to you? What are you at risk for anyway? By now, you probably know someone who has been affected by COVID-19. Maybe you know someone who has gone to the hospital. Maybe you know someone who lost a family member or a friend to COVID. Maybe you lost a family member or a friend to COVID. COVID-19 can make people very sick, but not all people get sick the same. People with Down syndrome get sick and die from COVID-19 more than people without disabilities. People with other intellectual and developmental disabilities like autism get sick and die from COVID more than people without disabilities too. People whose immune system don't work very well get sick and die from COVID-19 more than people without disabilities. People who are not vaccinated also get sick and die from COVID-19 more than people who are vaccinated. You can learn more about the new bivalent booster by checking out our easy read guide on it. That is linked below. Getting sick, going to the hospital, and dying are not the only problems you can get with COVID. According to the latest US Census survey data, over 28% of people who have gotten COVID say that they've also gotten at least one long COVID symptom. That is more than 1 out of every 4 people. Long COVID is a disability that happens after someone gets COVID-19. Some people get better after a few months. Some people have not gotten better for years after getting long COVID. No one knows exactly why people get long COVID. We just know it happens to a lot of people. We also know that some people get long COVID more than others. For example, people who are not vaccinated get long COVID more than people who are vaccinated. There are a lot of long COVID symptoms. Here are some symptoms of long COVID. Not being able to think very well. Some people call this brain fog. Feeling tired all of the time. Some people call this chronic fatigue. Coughing a lot. Having trouble sleeping. And having trouble breathing. The CDC has a good page explaining long COVID. That is linked below. How do I know if COVID is getting a lot of people sick in my community? The CDC keeps track of COVID-19 data. This data can help you. Here are some important data sources. Wastewater surveillance data. Scientists can test the poop we all flush down the toilet for indicators of the COVID-19 virus. This is called wastewater surveillance. When there are more indicators of COVID, that probably means more people are sick with COVID-19. Wastewater data is important. Not everyone tests for COVID-19 even if they are very sick. Some people who do test only use an at-home rapid test. While you can tell the Department of Health or another public health agency that you tested positive for COVID-19, not everyone does, so it doesn't go in the official count. But people who do have COVID will flush down poop that indicates COVID. That is why scientists track wastewater. The CDC data tracker has a link to wastewater COVID data, and you can read it too. Community transmission. The CDC data tracker can tell you how many people reported positive for COVID-19 in the past week in your county. So if you live in King County, you can go to the CDC data tracker, where it says COVID in your community, search for your community or state to view COVID data for your community. You can select Washington State and then King County. That brings you to a page which shows your community level and the data the CDC uses to say what your community level is. King County Public Health also has a site where you can check cases and positivity rates. One of these data is case numbers per 100,000 people. This tells you how many people out of 100,000 people the CDC knows tested positive for COVID-19. That means people who got a PCR test and people who reported their positive at-home rapid test. Another piece of data is the positivity rate. Some people who test to see if they have COVID do not have COVID, but some people who do test for COVID-19 do have COVID. The percentage of people who do test positive for COVID-19 is called the positivity rate. Positivity rates and case numbers are how the CDC figures out whether your community has high community transmission or not. A positivity rate of 10% or more means high transmission, but also a case rate of 100 out of 100,000 people also means high transmission. 100 out of 100,000 would be 1 out of every 1,000 people. If your county has high community transmission rates, that means there is a lot of COVID going around. Community levels. Community levels do not tell you how many people have COVID. It does tell you something important, however. It helps you know how many hospital beds there are. If you have to go to the hospital, it is important that you can get the care you need. Some people did not get the care they needed when hospitals could not serve all the people who needed it. That happened because too many people needed to go to the hospital for COVID-19. Some people died because they did not get the care they needed. Community levels are an important tool for understanding your risk if you are likely to go to the hospital if you get COVID-19. Case data, cases are also important for determining the community level. How does COVID-19 spread? COVID-19 is an airborne virus. That means people get COVID from breathing in COVID viruses. A virus is a kind of germ. When you get infected with a virus, such as COVID-19, you can give it to other people. That is how viruses spread. Viruses spread from person to person. You can get some viruses from touching counters or doorknobs that someone who is sick touched. You can get the flu that way, but most people who get COVID-19 get it from breathing in viruses. If you have COVID-19, you breathe out the virus. Anyone who breathes it in can get sick. That is what we mean by COVID-19 is an airborne virus. Can I wear a mask? Wearing a mask can help you and your community. You've probably worn a mask before. You might still wear masks every day. Masks help stop the spread of COVID-19. COVID-19 germs live in the air. A mask helps filter the air you breathe. Filtering the air means that you breathe in good air, but not contaminated air. This is why firefighters will wear masks. Masks filter out smoke, which could hurt their lungs. Similarly, a mask will filter out COVID-19 germs so you can breathe good air that won't get you sick, or at least mostly good air. Some masks are better than others. An N95 mask will filter 95% of the air you breathe if you wear it correctly. Cloth masks do work, but they don't work as well as an N95. Eric Mathis has a great video on wearing masks. The Autistic Self-Advocacy Network also has a great video on the different types of masks. Those videos are linked below. For the best safety, try to wear an N95. But sometimes you might want to wear a cloth mask, a surgical mask, or no mask at all. It depends on the situation. Personally, when I go to the grocery store, I always wear an N95. I shave my face so that the N95 fits well to my face. That helps it filter it better. What about ventilation? COVID-19 is airborne. When someone who has COVID-19 breathes, they breathe out COVID-19 germs. This is why the CDC says that a well-ventilated space is a safer space. Ventilation means that there is a lot of air moving around. When there's a lot of COVID germs in the air, you are more likely to get sick with COVID. But ventilation stops COVID germs from building up in the air. Opening up a window, using an air purifier, turning on a fan, or even just being outdoors are good examples of increasing ventilation. How do I know if somewhere is well ventilated? A place that is well ventilated has a lot of air moving around it. For example, the spot near the doors of a supermarket gets ventilated a lot. That is because the doors are opening a lot. A place that has windows open and fans running is also pretty well ventilated. If you feel air moving around, that is a good sign that a place has more ventilation. What about distance? COVID is airborne. You don't have to be right next to someone who has COVID to get it, but being right next to someone who has COVID makes it more likely you will get COVID too. So in addition to being somewhere that is well ventilated, you should try to spread out your gathering. If somewhere is crowded, it is harder to distance. A crowded place is also less well ventilated. That means a crowded place is more likely to give you COVID than a less crowded place. What about length of trip? Another way you might keep yourself safe from COVID-19 is by making shorter trips inside places. For example, when community transmission is high, you might want to spend less time in the grocery store. That is because the less time you are exposed to air with lots of COVID germs, the less likely you are to get COVID. What if I test? There is another great way to make sure you don't get COVID or give someone COVID. You can use a rapid COVID test to see if you or someone else has COVID-19. You can buy COVID rapid tests from most pharmacies and supermarkets. You can also get COVID-19 rapid tests from Washington State's government. COVID rapid tests are not perfect, but they are a good way of helping make sure you don't give someone COVID or get COVID from someone. You can find a link to get free COVID tests below. When should I use a rapid test? When would I use a rapid test? Use a rapid test if you know you were exposed to COVID-19. You should also consider getting a PCR test if that happens. Another time you might use a rapid test is if you're inviting a friend over. Testing for COVID before your friends come over helps keep everyone safe. If one of you tests positive for COVID, you should try to reschedule. If you are visiting someone who is high risk, testing before seeing them can help keep them safe from COVID. I hope these tips helped. We also have an easy read version of this. You can find that on our website, and it is linked below. Thank you so much for watching, and I hope you stay healthy and safe.